Namaste, all the viewers and friends. The topic of discussion today is frozen shoulder, which is also called adhesive capsulitis medically. But before I get into the topic, I would want to extend my gratitude to all of you who have been watching our videos, who have subscribed to our channel and are sharing our videos with your dear and near ones. We request you to continue your responses, and we would also be encouraged to make these videos more and more. So getting into the topic of frozen shoulder, it presents with pain and stiffness of either or both the shoulder joints, and it develops in 3 stages, or we usually observe 3 stages of frozen shoulder. The first stage is called the freezing stage, where there's some amount of pain, a little bit of stiffness in any of the shoulder movements, be it rotation, be it lifting your hand up where you're contracting the shoulder muscles, or if you're stretching them, there's going to be some amount of pain. So you feel that your shoulder movement is not as easy as it were to be before. So it is kind of freezing, beginning to slow down, beginning to contract. The next stage is called the frozen stage. In this stage, pain is not mandatory. Most of them do not have pain in this stage, but there is extreme amount of stiffness. So be it lifting the hand up becomes very difficult, taking the hand behind or taking it front, any of the movement based on which compartment of the muscle is affected more, it tends to become tight and the movement is very, very hard and the joint becomes very stiff. This is called the frozen stage. The last stage is called the thawing stage, where the stiffness begins to reduce, the movements start to become a little easy and free. Okay, that's the thawing stage, where almost the frozen shoulder is beginning to recover. That's called the thawing stage. So these 3 stages are observed in frozen shoulder. So why this happens is basically the shoulder joint has around it fascia, some capsules, some connective tissue layers, and on top of that the ligaments and the muscles. And when there is inflammation in these layers, the capsule or these layers of connective tissue become kind of attach one to another and becomes very tight. So that is the reason why your movements become very difficult and the shoulder joint becomes very stiff and the movements become difficult. So what are the risk factors, or what are the causes of frozen shoulder? Mostly injury, some sort of an injury, sudden jerk injury that can happen can affect the shoulder joint. If lack of, like how injury can affect, lack of mobility can also result in stiffness of the shoulder joint. It can be sleeping in a wrong position, some sort of impact that has happened to the shoulder joint. Many a times you also see frozen shoulder as a complex or as a complication of diabetes mellitus, thyroid issues, be it hypo or hyperthyroidism, at times with tuberculosis. It is very commonly seen in Parkinson's disease, which is a degenerative condition. So all of these are the causes and risk factors of frozen shoulder, and if not taken care of, it can lead to complications like the capsules that are there can enter into a tearing stage. So we usually call the rotator cuff injury. It can, the capsules there, the ligaments there can go into further damage if not taken care of, if the frozen shoulder is not taken care of in these 3 stages. So what are the management tips for frozen shoulder? First is definitely prevention. So taking good care of the joints, not just the shoulder joint, every joint for that matter, keeping our blood sugars under check, making sure that if we are diagnosed with a thyroid issue, we take necessary management, whatever needs to be done for it, be it medications, be it therapy, be it acupuncture, what needs to be done for thyroid diseases need to be done. So preventive health depends on how you take good health and good care of your shoulder joint basically. So exercising your shoulder joint properly, stretching all the muscles, making sure not to give any jerky movement while you're exercising. When you're lifting some sort of a weight, making sure that you follow correct steps and not do haphazard movements with the shoulder joint. These will help prevent shoulder joint freezing and entering into a frozen stage. Next, once you're going through the symptoms, what do you do? How do you manage it? See, we say frozen joint or frozen shoulder joint. So some amount of heat will definitely help ease the stiffness. So initially, hot fermentation bag application, exposing the shoulder joint to good morning sun rays, these are all very helpful in bringing down the stiffness of the shoulder joint. But hot applications, or when you apply heat to stiffness, it is a temporary management tip. You will feel temporarily very good because the stiffness has come down and the movement becomes easy. But what is a root cause of the issue is inflammation in those layers. So inflammation should come down. So what brings down inflammation? Definitely good nutrition, good breathing exercises, good stretches with breathing. Along with that, when it comes to therapy, acupuncture is something that is very, very effective in managing frozen shoulder without any medications. So when acupuncture is done, it involves inserting needles in specific points around the shoulder joint to locally help the inflammation. When the points around the local joint are put, the inflammation comes down, pain comes down, stiffness will reduce. Basically, there are neurochemical changes that happen, and that improves the health of the joint. So there are natural painkillers that are released when the needles are put, and that will bring down the pain, and also anti-inflammatory changes that happen with the needle. There are also certain specific points apart from the local points that are used to manage shoulder joint. It is to improve the muscle health, the joint health, the ligament health, to improve the circulation, better flow of the blood and also the lymph, so that there is draining also happening properly, nutrition supply also happening properly. So when we work on the muscular health, the bone and the ligament health, along with the local anti-inflammatory methods, we will get real good results for frozen shoulder. When it comes to diabetes induced frozen shoulder or thyroid disease induced frozen shoulder, even then acupuncture is very helpful, because diabetes and thyroid disease can also be managed with acupuncture. So there is secondary appearances of the frozen shoulder because of these diseases can also be managed, and primarily because of an impact or injury can also be managed with acupuncture. So that's how acupuncture is very, very helpful. Once the pain and stiffness is subsided, then we can take yoga therapy as a follow-up and for maintenance, and these stretches in the yoga, breathing exercises in yoga, relaxation techniques in yoga will help maintain the health of the joint, keep the muscles supple and in a relaxed manner. So this is how we can effectively manage frozen shoulder in any stage. The duration of the treatment depends definitely on the severity and the duration of the disorder itself. So if it's a long-term frozen shoulder issue, definitely more number of sessions will be required. So with that, I think I've given you all the information when it comes to the causes, risk factors and the management of frozen shoulder. Please visit our clinic if in need of management of frozen shoulder. With that, I end the session. Thank you.